Welcome, everyone. This is News Now from the Belmont Journal. I'm Mike Crowley, and Lisa Gibalerio of the Wayside Youth and Family Support Network is with us once again today. Lisa is also coordinator of the Belmont Wellness Coalition, and it's good to see you again, Lisa.
Thank you, Michael. Great to be here.
All right, so today, Lisa, we're talking about fentanyl. This is something we hear a lot of news reports about it. Lisa, help me understand what this is.
So fentanyl, Mike, is a type of opioid. It is FDA approved, usually to treat severe pain. So it's prescribed after surgery by doctors or sometimes, in labor for women, but it is an approved drug to treat pain.
All right, so let me ask this. What makes fentanyl so different from other pain relievers or other drugs? Why is it in the news so frequently?
So it's a really strong opioid. It's about 50 times stronger than, say, heroin and 100 times stronger than morphine. And you're hearing about it, Mike, because it can, if used inappropriately, cause overdoses and sometimes even death. So most of those overdoses that you are hearing about are linked to illicitly made fentanyl, which is created in at-home labs and distributed kind of through the underground drug markets. It's not what's being prescribed by doctors. So what happens is this illicitly made, lab-made fentanyl is added to other drugs, and it makes them incredibly powerful, more addictive, cheaper, and ultimately really dangerous.
All right, so I want to ask, how is fentanyl affecting teens and young adults?
So they are getting it in ways that they don't even know it's there, right? It's tasteless. It doesn't have an odor. They won't be able to see it. So what typically has happened is they might be online trying to get their hands on Adderall or trying to get their hands on something else. And what they don't know is that because it's not doctor prescribed, because they're getting it through a backdoor channel, it has been tampered with. So it has been added to, again, maybe MDMA, maybe Adderall, maybe another pain reliever. And so they don't even know it's there.
Now, if they aren't getting this directly from a doctor's prescription, Lisa, how are people getting a hold of fentanyl?
So again, my understanding, Mike, is through a back door, often online. This isn't something I would know how to do, or most of us from our generation would know how to do, but the kids know how to do it. And what, again, they don't know is that what they are buying through a backdoor channel online could be laced with fentanyl. So the point to stress here is that if your doctor prescribes fentanyl for an injury, for post-surgery, it's 100% safe because it hasn't been tampered with. It's getting it through these backdoor channels that's posing the risks.
Now, always important, Lisa, and you mentioned kids. What should parents be discussing with their kids?
So they should be talking about substances in general and the risks of certainly taking anything not prescribed to you by a doctor. So that's first and foremost. And of course, bring into the conversation the risks of buying things online. Say explicitly that you are not sure what you're getting. It could be laced with fentanyl, which makes it risky. So equip your teens with accurate information. Don't scare them. I mean, but let them know that they need to make smart choices. And this should not be a one-off conversation. Keep the lines of communication open around substances.
And is there anything, Lisa, that parents should be saying specifically about fentanyl?
Just what we've said here today, Mike, that it is odorless, it's tasteless. They wouldn't know it's in something that they got online. And that if by chance it's prescribed by a doctor, it is not risky because it has not been tampered with. Just that lab-made fentanyl is being added to other drugs, and small doses can be really dangerous because it is so strong, as we noted earlier.
All right, thank you, Lisa. Um, it's probably worth saying too that Narcan, which can be used to save somebody who's overdosed on fentanyl, is widely available. You can find it at CVS and most drugstores, um, and it's good to have on hand.
Absolutely, Mike. It's been around town, occasionally at the senior center, the health department. It's easy to use, and it is a smart idea just to have it around on the off chance, that there is an overdose. You can reverse it with Narcan.
All right, Lisa, we'll see you next time, and thank you again.